Let's see. Should you start CNA before nursing school? Will that get me into nursing school? Will it give me more experience? What to do, what to do, what to do. It's Kardiackai and I'm here with another video. First, y'all, I got some subscribers! Yeah! Hey, y'all. Thank you for subscribing. I am very new to YouTube, making these videos and stuff. So thank you for joining. And as you see, this video is CNA before nursing school or medical assistant before nursing. First question, should I go to CNA school before RN school? The answer is, if you don't want to, you don't have to. First, I'm gonna say a CNA and a registered nurse, they do totally two different things, okay? Of course, they come together, they work together so that they can meet the needs of the patient. So I'm here to tell you my story, my experience, and how I became a registered nurse and whether or not becoming a CNA would be vital or important in becoming a CNA and whether you have to do it. Some people say you have to do it, girl. No, let me tell you something. You do not have to be a CNA or have CNA experience to become a registered nurse. You do not. I know people that was in my class, they worked for banks, they worked for insurance companies, they did all type of things, and they are great, wonderful nurses now, okay? Would I recommend you becoming a CNA? Honestly, I would recommend you becoming a CNA. Now, I didn't go and pay for a class to become a CNA. No, I got into nursing school, and here in Jacksonville, a lot of the hospitals, what they're saying is if you are a nursing student and you have completed fundamentals of nursing, guess what? You can be a CNA as long as you're in nursing school and you have completed that class. So that's what I did. And becoming a CNA, it actually, it puts you in the groove. It gets you experience. It gets you hands-on experience. Hands-on. Yes. It gets you hands-on experience. It gets you comfortable with dealing with patients. It gets you comfortable in communicating with patients. It gets you comfortable in the collaborative care that you would see in the hospital setting. So when I became a registered nurse, did CNA help me be a better registered nurse? Like I said before, they do two different things. What certified nursing assistants do is they assist with activities of daily living. That means helping a patient walk, helping them brush their teeth, helping them get dressed, just talking to them, comforting them. Activities of daily living. Nurses do things a little differently. They care for the patient and they manage the patient's pain of care holistically. I'm gonna say holistically. Sorry, y'all, it's the caffeine. So here's the thing. I was a CNA, but before I was a CNA, guess what? I was a medical assistant. That's right. I was a registered and certified medical assistant. And you know what? That being a medical assistant and being a CNA, they prepared me for nursing in two different ways, two different aspects. So as a CNA, I was able to actually help care for the patient in an inpatient setting. So I was able to build relationships with these people. We got very, very personal. You know, as a CNA, you get very personal with a patient. You know, body parts and body fluids and all that type of stuff. You get comfortable with the inpatient setting. As a medical assistant, it actually prepared me better as far as my skills as a registered nurse. So before I became a registered nurse, I knew how to draw blood. I knew how to give intramuscular and sub-Q injections. I knew a lot about anatomy already. As a medical assistant, I kind of transitioned to being a medical scribe for this anesthesiologist. So I knew a lot about the EMR system. I knew how to chart. I knew how to transcribe. I became very familiar with the computer, terminology, knowledge. Let me tell you something. As a medical assistant, you are the doctor's literally right-hand man, or you are the nurse practitioner's or physician's assistant right-hand man. They depend on you for literally everything. You prepare the rooms, you prepare the charts, you assist in all procedures. So as a scribe medical assistant for this anesthesiologist, I was in the room assisting him with all procedures. So that was down to nerve blocks, different type of joint injections, spinal injections, nerve blocks, all different type of things. I even went with him in the hospital because he did kyphoplasties. That's actually like surgery on the spine. But that prepared me in a lot of ways that being a CNA did not prepare me. With being a CNA, you are that nurse's right hand man as well. As a CNA, you know, nurses, guys, we are so busy, and it sucks because how the way the healthcare system, how it is right now, you have to do a lot more charting, honestly, than spending time with the patient. It sucks, but that's just how the way it is. And we depend on nursing assistants actually to tell us a big change in things. You'll be surprised, like, as me being a nurse and, you know, my CNA comes and says, hey, he's breathing different. Hey, something's not right. Something's not wrong. And I run in there and sure enough, something's wrong. That's right. I was a medical assistant, and then I went to nursing school. I finished my first class in nursing school, and I became a CNA. So I became a CNA at an LTAC, a long-term acute care facility. What that means is these patients, they need more time healing, basically. And you know, insurance, you know how insurance companies are, they like to cut it, okay? I'm not gonna curse, they like to cut it. And so a lot of the patients that I had working in LTAC, they were on ventilators, they were on trachs, and let me tell you, they had massive wounds to where you can see their bone, you can see the muscle. It stunk the whole hallway. That's how bad these wounds were. And as a CNA, at that particular facility, we did a lot. Like, we did a lot of things that nurses did. So we did wound care. Wound care, y'all. We did wound care. We also suctioned patients, which is a RT job, and it is a registered nurse's job. We did suctioning and we did sterile suctioning. We did a lot in that facility, and that helped me prepare me as a registered nurse. Also, CNA's jobs from facility, it varies. Like on the CVICU, the CNAs now, they do not do that. They take vitals, they take blood sugars, they assist with walking, assisting them, brushing their teeth, getting their clothes on, stuff like that. They're not as hands-on as the CNA. When I was a CNA in an LTAC, okay? LTAC and an inpatient hospital, they're two different things, okay? And that prepared me. So when I graduated nursing school, I had to stop being a CNA. That's right. And I had to become a sitter. Being a sitter, I swear to you, was the worst thing, because let me tell you something. I'm moving. I am moving. I'm the type of person where I need to move. I don't need to sit down. You know, I need to be doing something. And the month that I did that, because I was studying for boards, oh my God, y'all, it wasn't it. It was not it. So when I got my license, they actually offered me a job. I did not take it, even though I know I would get good experience. But the facility was so small, and I knew that if I went to a different, a regular hospital, there'll be more opportunities. So I hated to leave. Lord, I didn't. I like that facility, and I like the nurses, and I like the CNAs and everyone there, but it was just better opportunity for me at the facility that I'm at now. So it's getting dark. Let me turn on some light. Okay, I should have done this like as soon as I woke up, but I didn't. I was sleeping, and so I just randomly said, let's make a video, and that's what I did. So yeah, I had to turn on some light. But anyway, I hope this gives some type of insight into whether you should make a decision to spend money and become a CNA. Honestly, you do not have to be a CNA to become a registered nurse. Will it give you more experience with patient care? Yes. If you want it, do it. Go for it. Be a CNA. If you want to be a medical assistant, you can be a medical assistant and still become a registered nurse. It just gives you experience in a different way, in a different form. I would recommend for all you nursing students or those who wants to be a registered nurse, go be a CNA. You know, go get that experience, you know, and it will give you an opportunity to have a job lined up fresh out of nursing school. That is a fact, for sure. So I hope this video helped someone. If you have any questions, just drop them down below. Thank you again for subscribing. I will do my best to post nursing related videos for you all. Look at the time. A sister do have to go to work. I did pick up overtime. I'm always picking up overtime. Why? Who doesn't like the extra money? But I actually picked up overtime on my home unit, my old home unit. So when I became a registered nurse, I started off on cardiac progressive care. So it was the CVICU step down ICU unit. So I started off there. I did my year there, and then I transitioned over to CVICU. Now, I saw one of the nurses there yesterday in the cafeteria, and I'm like, oh, how is it? I'm picking up. She was like, girl, run, go home. It's a train wreck. And I was like, oh, Jesus. Sorry. You know, sometimes like when you want to make some extra money and you pick up overtime, oh, you gonna work for that extra money. You gonna work for it. No doubt about it. Okay, guys, I'm gonna actually finish getting dressed. I'm gonna go to work. I'm gonna knock out this extra night, have 2 days off, and I'll see you all next week. Bye.